Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is non-operative treatment for adult scoliosis. What exactly is adult scoliosis? Well, it's a rotation and curvature of the spine due to degeneration. So it's very different than pediatric scoliosis. It's much more painful typically than pediatric scoliosis. It's stiff because as we get skeletally mature into adulthood, you start to lose that flexibility of our spinal curves, and it often causes both back and leg pain. Pediatric scoliosis causes pain in less than 20% of individuals, and it's usually not that severe. Adult scoliosis is very different. Why does it occur? Well, there are two reasons that adult scoliosis occurs. One is it can be an exacerbation of scoliosis you had as a kid. If you had scoliosis treated or not as a kid and it was not operative, and you had a curve that was over 40 degrees, which is questionable as to whether or not you should have surgery or not, well, biomechanical studies show that in adulthood it usually gets worse at 1 degree per year. Okay, so not so bad like when you're 20 and then you get to age 30, it's about 10 degrees worse. But think about it, when you get to age 70, if you started with a 40-degree curve at age 20, you're talking about a 90-degree curve. So it can really add up over the years, and that's the first way that it can occur. The second is typically due to spinal degeneration. You didn't have any curvature as a kid, and then in adulthood with degeneration, it starts with the disc. The disc degenerates. It pushes abnormal stresses to the joints in the back of the spine called the facets, and then you start to get instability and asymmetric degeneration, and then it can start to pinch on nerves. So here's kind of what you can see is this is an adult scoliosis x-ray, and you can see that there's asymmetric degeneration. This disc space looks great, not so much over here. Okay, so that's where you have the convexity of the curve and then the concavity on the inside. You see how there's a lot less space from where the discs have degenerated? There's nerve roots trying to get out here. They can get pinched. That's called spinal stenosis. Okay, so the arthritis can lead to significant back pain and muscle weakness and aching from trying to stand up straight. You see how the pelvis is even tilted? It's hard to stand up straight. And you can also get buttock and leg pain from the spinal stenosis. So what are the treatments that are available besides surgery for adult scoliosis? Well, the first is for mild to moderate pain, over-the-counter medications, anti-inflammatories, Tylenol, prescription medications such as higher strength NSAIDs, narcotic medication, neuropathic medication such as Neurontin and Lyrica for the leg pain can be very helpful. And there's also topicals. If someone has focal pain in the low back, then there's topical medications like lidocaine, patches, creams of nonsteroidals, things like that can help a lot. Physical therapy can be very beneficial by strengthening up the muscles around the spine, along with ultrasound, electrical stimulation. Interventional treatments are what we're going to talk about next, and those can be vital to helping a patient stay non-operative with pain relief. The first option is what's called facet injections. And here's the spine, here's a facet joint, okay, and those get arthritic when a person has spinal arthritis and scoliosis. So the needle goes into the joint, steroid is placed just like it is in other joints, and it can provide relief for weeks to months. Trigger point injections are placed just into the superficial area of the back, and for someone who has spasms and aching, those can be very beneficial. These two pictures show on the top a medial branch block. So this is looking at your back, okay, and these are the joints on the side. These little nerve endings are called the medial branches, and they supply sensation to the joint. A joint has to have some nerves to it to feel pain. So a medial branch block will block the transmission of these nerve endings using numbing medicine like lidocaine and some steroid, and you can get pain relief for weeks to months just from that. All right. Now, if this wears off, it can either be repeated, or a person can go on to have what you see here, and that's called a radiofrequency ablation. And basically that's applying thermal energy and heat to the same area around this joint, not in the joint, but around it, and deadening these nerve endings. And that can provide pain relief for 6 to 18 months. So consistent pain relief, and then if it wears off, it can be repeated with the expectation the same results will be seen. Epidural injections do work well for the pinched nerve aspect of adult scoliosis. We call it that spinal stenosis. That can be given as a series of 1 to 3 injections, and that can work extremely well for weeks to months, and then it can be repeated as necessary. But what are the outcomes with non-operative treatment? Well over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without going to surgery. Between the treatments for back and leg pain, most patients don't end up needing surgery, and it's an elective procedure. It's quality of life. There are significant risks associated with it. If you look at this here, this person had a 70-degree curve, lots of pain. They went on to have a decompression, freeing up those nerve roots that were getting pinched. And like I mentioned, it's on the concave side here. And then they had a long spinal instrumentation infusion. This is a procedure that usually takes a couple days. You have to stage it. There's a lot of hardware being put in between the discs as well. So it's over a 50% complication rate and upwards of a year of rehab. So it's a decision not to be taken lightly. In Nevada, the best pain management doctor is in the Nevada Pain Network. It's comprehensive medical and interventional treatments along with PT, chiro, several locations taking over 50 insurances. The doctors are all board certified, and they've achieved the Patient's Choice Award 5 years in a row. So very highly skilled. The number to call for scheduling is 702-323-0553. And visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.